The evolution of an electronic medical record for Bendigo Health is a critical development for us because it will provide several positive things that we can work upon to deliver that care. The other key issues which we need to address with this new electronic medical record is that we have problems at times in the current circumstance with people being on the subacute side of the campus or the acute side of the campus. And consequently, there are two medical records. We need to marry those, which will be done with the electronic medical record, and thus we'll have immediate access to all of a patient's information, not just parts of it. This has been a problem in the past, obviously, where those two things aren't together. So this will help to solve that as an issue and give us access to that information where we want it, when we want it, and about the services we need to know about. This issue of two potential records that are separated in space and time, e.g. the acute record and the subacute record, becomes particularly important because many of our older patients really have very complex issues to deal with, and usually many complex issues, not just one at a time. So if we don't have all that information together at that point of care, then we may make a decision on the basis of part of the information, not all of the information which we need to do so. But of course, once we've done that, we can then do better planning for them to be discharged either from the hospital or the clinic, and then go forward with the knowledge that their carers from then on, that is, the general practitioners or community nurses or others, could then have also access to those records with ease rather than with difficulty. Of course, all of the above really adds to our next prospect, which is not just delivering a great clinical service, but also using that clinical service and the electronic medical record to then be a basis for future research. Bendigo Health is in a situation now where it can start to develop a much greater platform for that research. And I think with the evolution of electronic medical record, that will only add to the ease with which we can plan those sorts of endeavours and get going with research. So for all staff, I'd really strongly encourage you to be part of this, be part of the EMR development, part of the development of how it fits into this system, not just bringing something in from outside and just making it fit, but rather add your dimension to it, add your input. This is critically important because it happens to really affect everything you do and will affect everything you do, whether you be a medical consultant, whether you be a junior medical staff, whether you be a nurse, an occupational therapist, a kitchen hand. Everything will be affected by the impact that this medical record has on your functioning. So just be part of it. Get out there and offer your shoulder to the grindstone and make it as good as it can be.